Very early in my career, there was a patient with breast cancer that I was treating, and she looked pretty dejected as I was following her along. And I said to her, this must be pretty hard. This was in the days before we had the breast cancer support personnel. And she said, it makes you think about more than whether you paid your utility bills or not. And for some reason that really got in. For some reason that really made an impact on me to figure that, your day-to-day functioning is changed. It's immediately changed, and it will forever be changed. This is a chronic diagnosis. It does not go away. And so once again, to be able to find a way for that person to cope and to continue functioning and be productive, I think is a remarkable thing. There's nothing so gratifying to me as having a patient that I treated years ago come back, and they look a little weary. So you say, well, what's going on? And they say, oh, I was running around after my 2-year-old granddaughter. And so that to me is the most rewarding thing, because that person struggled and they survived, they found a way, and they're touching other people so that goodness continues for the rest of their lives. We've done a number of things to develop a breast cancer treatment center. We've hired competent surgeons, breast cancer coordinators, breast care coordinators. We have developed a tumor board where we discussed cases that may have alternatives. We've started a comprehensive program for basically one-stop shopping for breast diagnoses. So the patient will literally be referred to the surgery department having had a mammogram, an ultrasound, and a core biopsy done the same day before they see the surgeon. So that just speeds the process along, hopefully reduces the anxiety that the patient is having in order to have to wait for their definitive diagnosis. So I'm very proud of all those efforts for the department, and I'm especially proud of my colleagues. When you come out of training, you think you know everything, and you pretty quickly learn that there's a difference between a textbook and someone looking over your shoulder and being primarily responsible for someone. So it could be a challenge because you're not quite sure if you're up to the task, and there's a lot of self-doubt, there's a lot of emotional and physical fatigue that go along with it. But I think that if you persevere and if you just project to patients that you truly are concerned about them and what happens to them, the reward is astounding, because they will give you back so much more in return. They will teach you in a way, and they give you clues about what they really need. I've known past recipients either personally or by reputation, and I know how much they work toward eradicating breast cancer and treating breast cancer patients. So to be selected was indeed a great honor for me, and I'm very appreciative of the award.